Hi, everyone. Welcome to today's special podcast. My name is Vidya Lalgudi Jaishankar. I am an artist and a volunteer at TISA. I am excited to host this conversation today, and our guest is Harshada Barve. She is a speech and language pathologist. She earned her bachelor's in audiology and speech language pathology with distinction from Bharati Vidyapeeth, where she also received the Manohar Memorial Award for Best Paper in Speech Language at Isha Conference 2022. She then completed her master's i- a- at the All India Institute of Speech and Hearing, earning a gold medal in language pathology. Her dissertation explored the impact of stammering on Indian women, and she also attended the TISA Vanvadi communication workshop to deepen her understanding of stammering beyond clinical perspectives. Hi, Arshita. It's wonderful to have you here. Thank you so much for joining with us. Um so let's begin with your journey into speech and language pathology. So what initially drew you into this field, and what got you interested in stammering?
Okay. So I always knew that I wanted to do something different, and that was sort of what drew me towards this field of speech language pathology. And it was actually my father who introduced this to me. And then once I read up about it, I felt very confident that, this is my calling, this is what I want to do for the rest of my life. So, yeah, that was it. There was no going back after that. And regarding stammering, so I have always been interested in psychology. And what intrigued me about stammering is that it's not just you use some specific technique and it's fixed, it's done. No, it goes much beyond that. It goes into the person's psyche. So that's what drew me into stammering and, everything related to it. And most of what I do now is an effort to get a better understanding about stammering.
Actually, you never know where you find your musing, right? It's really interesting to know about your journey into this field. But you have also explored stammering beyond academics. Like you recently participated in the TISA Vanvadi communication workshops. So, can you share your experience there and what were your key takeaways?
Yes, yes, definitely. So, I mostly wanted to, so I must share, I was a little skeptical about attending the workshop because I knew everybody else would be someone who stutters. And me as a person, I would have felt like an outsider in that environment. And also, I knew that some people, some of the participants would have had past experiences with speech therapy, or some might not even know what that is. So I was a bit nervous if that would have become a hindrance in the workshop, but once I went there, there was nothing to be concerned about. I knew that, everybody was so warm and so welcoming, and it felt like I entered a different world of verbal diversity where, everybody has their own different way of speaking. And yeah, and also, so one thing that really struck out to me was that everybody was so comfortable with each other and with their stammering itself that they were even joking about it. We even joked that, by the end of the workshop, I might start stammering.
Yeah.
So yeah, and one of my main motive was like speech techniques. I know all of them. I know them by heart. I wanted to know from the inside more about the thoughts and feelings that go behind stammering. And the second thing is that I wanted to destigmatize speech therapy also in a way. So many of the participants had questions for me, which I was very happy to answer because traditional speech therapy, I can say that it has not been kind to stammerers. But now the field has come a long way. And with stutter affirming practices coming up. So I just wanted to create awareness about that as well.
Sorry, what is that? Stutter? Affirming.
Stutter affirming practices where the goal is not to be 100% fluent or speak without any stuttering. The goal is to stutter but easily, effortlessly,
Okay.
that way.
That is actually the main point of TISA is to where we encourage uh, to improve the communication and to
Right.
speak without struggle. So it's fascinating how this workshop encouraged a more natural and open approach to communication. And in many ways, it also reflects what self-help groups like those in TISA do. Like they create spaces for people who stammer to connect and support each other. So, from your perspective, what makes these self-help groups valuable, and how do they complement the clinical approaches?
Right. Yes. So, as a person who is typically fluent, there is a limit up to which I can relate to experiences of a stammerer. It is very easy for me to say that just accept your stammering. But a person who has actually gone through the process, they know how difficult it is, and they might have some insights, more insights into it. So, the same thing coming from a person who has experienced it would be different. In fact, it would be more motivating, even reassuring.
Yeah.
So, I think self help groups bring out that wherein you see other people's experiences and you feel motivated yourself. And another thing I would say is that in speech therapy, what you could do is you could master the technique, practicing the technique with yourself, with the therapist in, a very restricted setting. And then rather than just transitioning directly into the outside world and trying to use the technique outside, you get an opportunity in self help groups to practice it in a safe space with people who are understanding, but also you have an audience.
Mm.
So
Yeah.
that's like a good transition from the clinic to the outside world, I would say.
So that's a great point that you said. So alongside this practical engagement, research is also another way for which we can, I mean, from which we can understand stammering in depth. So your dissertation focused on the impact of stammering on Indian women. So while you may not be able to, talk about your research findings yet, so what existing studies do you find most informative and insightful?
Yes, yes, I'd be very happy to share about that. So I did a very deep dive into the literature during my dissertation work. So the earliest research that included any data specific to women stutterers was around 1955, wherein they studied stuttering and non-stuttering people, and they studied their levels of aspiration.
Hmm.
So, in that research, they discovered that women in particular had a lower esteem than men. And after that, so this research was conducted by Dr. Sheehan. You must be familiar with him. So, he replicated that study again in 1979, but this time including only female participants.
Okay.
And he saw that although self esteem had improved from 1955 to 1979, it was still lesser in female stutterers as compared to women who didn't stutter. So over there we can see that the generation gains have happened with more improved status of women in the society. And it must be interesting to, do another study almost 50 years later to see where women stand right now.
Mm.
And so that was about Dr. Sheehan. Another study spoke about this dual discrimination, which comes with being a woman and also being someone who stutters. So, in society, there are many stereotypes, there are many expectations that come along with being a woman as well as being a person who stutters. So, facing this dual discrimination was impacting women at a much deeper level when compared to men. That was another finding. And so basically, all of these stigmas, you know, if there were women role models who stutter, that would have helped a lot. So there is a dearth of role models who stutter who are also women.
Mm.
But now we have, if you see the Stuttering Foundation's website, they have a list of few people. You see Emily Blunt over there, Marilyn Monroe over there. Because women who stutter are already a minority, finding role models is that much difficult. But I think with, so much access to the internet, globalization, and everything, the world has come closer. So it is more possible at this point to get someone to
Mm.
motivate you that way.
Yeah, absolutely. And also the cultural and the social aspect of it, as what you mentioned, affects in different generation. Even in 1955 as well as in 1979, research would have considered those factors too. Um, so thank you for sharing these insights. Um, this also helps us to, rethink how stammering can be addressed. So, what are some misconceptions about stammering that you would like to challenge within professional or academic settings?
Yes, so we know there are many myths around stammering. One of the most common one is that people who stammer are not smart or they're not competent enough. And this probably stems from societal beliefs, from what is portrayed in the media, films, all of that. So that would be something that must be challenged. And if anybody is facing this at their workplace, they have all the right to question it, to ask them. There is no evidence as such that proves any of this. And another thing is that people believe that stress causes stammering or being nervous causes stammering. Now, getting into the causes of stammering is a whole nother topic. But what we do know is it's not either of these that are causing stammering, but rather they might increase it, they might exaggerate it, they might aggravate it to an extent, but they are definitely not the cause of stammering. And over here, I would also like to talk about ableism. For people who don't know, ableism is basically the assumption that a person should be able bodied without any impairments, may it be physical, mental, communication related, no impairments. And any deviation or any difference from that means that you are at a loss. This is something that is very prevalent in society, where even you might notice that your goal would be to not stammer at all. Why is that your goal? Because society tells you it is.
Yeah,
So, to question that as well, it's so ingrained within society. You actually have to put in efforts to see where this ableism is coming up. But this is definitely something that everybody, not just stammerers, everybody should be aware of, and we should be having more conversations about this.
exactly. Yeah, yeah. I mean, continue. Sorry.
No, no. So, yeah, that was the thing I wanted to speak about. So, just. self advocating in an instance where that is happening, that would help you build confidence as well. And that in turn would again reinforce and help you speak more.
Yeah. Um, so when it comes to the lower part of the iceberg, that is the stress,
Mm.
anxiety, shame, guilt, all these, how in clinical approaches is being addressed. So would you like to?
Right. Yes, yes, definitely. So currently there's a lot of research being done on this topic. We have many approaches. So there's sort of like a collaboration between the cognitive behavior field as well as speech therapy.
Okay.
So we have approaches like acceptance and commitment therapy.
Mm,
We have cognitive behavior therapy, which has been around for quite some time. There's rational emotive behavior therapy. And more recently, we have mindfulness based interventions as well.
mm,
So now I think it's common knowledge that the first step to managing stuttering is acceptance. And once that comes in, that's when you can actually go ahead, make the progress. Once you break that vicious cycle of, thinking about stammering, which then leads to stammering, which then again reinforces that thought that, oh, I might stammer. So once that cycle is broken, once you accept that there might be some times where you might stammer, once that is done, then I think everything else might become easier. Stammering itself might become quite easier. So, there are even studies that are being done which are combining, for example, fluency techniques along with acceptance and commitment therapy, wherein the devising programs which can incorporate both of these.
okay.
So, this is all experimental at this stage, but all of it is showing really good results. And this, I believe, is the key to more resilience because we know that although you might use a specific technique and it might help you, there might come a time where you have a bad day and you're trying to use the technique, but you're stuttering again. So, if we're not working on the psychology, on the cognitive part within therapy, this is where this downfall might really hurt. It might become difficult for you to get back up. But when we're incorporating all of these approaches, like cognitive behavior therapy and all of these, that's what will make you more resilient. It
Mm,
will help you come back up quicker because you accept that there might be a chance of relapse. And when it does, you have the tools in your toolkit. You know what you have to do in that way.
yeah. Thank you so much. There are a lot of new things that we are learning while having this conversation. Um, so when it comes to self-image, I mean, identity uh, of people who stammer. So what do you think about that? Like you have had a little bit of, I mean, research and study in that, right? Like, can you share more about your, share your insights on that? Yeah.
Yes, definitely. So, most of the researchers have found an association between perception of the person and the people around them. So, basically, if, for example, we have a person who stammers and he or she has a family who's very supportive, who are not putting pressure on them to be fluent, who are not pointing out when they're stammering, the person himself or herself would be more comfortable, would have a better self image, would have a better sense of self. Whereas compared to the opposite, where the family themselves doesn't quite understand what stammering is. I think that is something that would help educating them about stammering. So when a family is not supportive, that is when even the self image takes a hit. So, what research states is that two things. The person's sense of self is by how they see themselves, as well as how people around them see them. view them that way.
Yeah. It's important to understand like stammering is multidimensional and how we approach it. Yeah, I mean, we need to approach it as from all the direction. That's what makes it, I mean, much more complex thing to address. So thank you so much.
Definitely.
So actually, this brings us to the end of my questions. I would now like to welcome our audience to share any thoughts or questions they have.
Hi. So my question to Harshada was that when she was talking about the psychological part and its role in stuttering, she says that it is very much important to address that specific dimension to it, that is psychological. So, when she's saying that, then how do we do that exactly? Like, what steps do we take to do that?
Okay. Um, I'm sorry, is this Siley by any chance? Your voice sounds very familiar.
Yes, Harshada. Yeah.
Hi, Siley. Okay.
Hi.
So, um, addressing the psychological part from a professional perspective, we do incorporate some aspects within speech therapy. Like within the session, if we're working on speech techniques, a part of the session would be dedicated to work on the psychology of the person. We have a few activities and tasks that you can do. If you feel that that is not enough, taking sessions even with a psychologist, someone who has knowledge about stammering, is more aware, that would be the way to go.
Thank you, Harshada, for the answer. And when you are telling that during the speech therapy sessions only,
Hmm.
you organize a part that deals with the psychological aspect of stammering. But so as in far, I have been to two or three speech therapists. None of them have included that in that. So yeah, I'm happy to see the new dimension that will be a lot more helpful in dealing with the stuttering's psychological part as well.
Yes, yes, definitely. That is what actually really saddens me, that practically in the field we don't have a lot of people focusing on the psychological part as well. But I am hopeful that, with the upcoming generations, we see this improvement because this is what is happening outside as well.
Yeah, true that. Right.
Yes.
Thank you, Harshita.
Yeah.
And thank you, Sayali, for your question. Rusha,
Thank you.
yeah.
Hi, hello. First of all, thank you so much for being here. Like it was amazing to like hear you. And like when I saw the poster and like saw that you had researched on like females who stutter, that is like an area of my interest as well. So like I was really like excited for it. So like I had two questions. So you talked about the social aspect, like how, like so like societal perspectives on gender sort of shape the experiences of uh, uh, women who stutter, and like I myself am a female who stutters. So like something that I wanted to know is that in clinical approach, like what kind of differences do we find based on gender in females who stutter, except for the fact that like there's a discrepancy in uh, um, confidence or like self-esteem, as you mentioned. Is there like any kind of gender like specificity that sort of like differentiates women who stutter from men?
Okay. Hi, Rusa. Okay, I will tell you this quite briefly. What happens is basically when you have to research about experiences, life experiences of a person, it usually comes into qualitative research. And this is, I would say, more specific to values like what I mentioned earlier: self esteem, confidence, sense of self image, all of those. So we don't have really concrete data that is differentiating. Most of the data that is there, it's much older, that I mentioned Dr. Sheehan's study. There were another study done by Silverman and Zimmer, again in the 1980s, who again had similar findings that women had lower levels of confidence. So that's what this is, where research needs to be done. More focusing on women, because even in studies that include women, we don't see a gender comparison that is being made. Most of the studies are not doing that. And because prevalence of stuttering itself is more in men, the data then becomes more male biased, since there are lesser female participants and more males. So, having more studies which involve or focus specifically on women is the need of the hour, I would say.
Yes, that makes sense. Like, I have actually like read a few papers that sort of like delve into it, and like I have read Tian's paper, so I was like chuckling to myself when you were like talking about it. So like, thank you for the answer. And like one more question. So sorry,
Yeah,
but
yeah.
like, so like,
No, no need to apologize. I'm your turn.
yes. So you said that there's no specific data. So that also means that like the intervention, like, is not different. Like, therapeutic strategies are not different for like uh women, because like recently, like in psychology therapy, gender differences sort of like come into this, and like we have gender affirming therapeutic um intervention. So like that still is not there. I'm like thinking like,
Um, for specifically for speech techniques, we actually don't have like a particular technique that works with everybody. We have to customize the therapy session depending on each and every person. And of course, to answer your question, we don't have any technique specifically for women stutterers and some for male stutterers. But in the practical world, what we do is we do some trial and error with a few techniques, and depending on which technique the person is most comfortable with, which they're finding most easiest to use, that is the one that we go ahead with.
makes sense. Thank you so much for your answer.
Thank you, Rusha, for your question. Saurav, would you like to ask your uh, question? Yeah.
Yeah, yeah. Thanks, ma'am. Um my question is to Harshada. Like, ma'am, what I got to know about the stammering is like somehow it is a neurological problem that differentiates us from being a normal or the ordinary person. But apart from that, like because of, let's say, if someone working professionally, and if they have some task and with some deadline, somehow if they unable to deliver that, so in that case they feel anxiety or stress. So this is what I think we call it the psychological problem, because uh, we do not like in that case actually uh, we are unable to do anything, and we just remain with ourselves. So my question uh, is to Harshada, is that like how can I recognize the problem that I'm facing, which is of course the conditional space, uh, that is coming from the neurological part or from the psychological part. And apart from that, let's say, coming to the stammering, uh, stammering, let's say there is a word tremendous. I usually able to pronounce in front of mirror and when I am stand alone. But this word, or like there are many words I cannot pronounce the in front of public or the crowd. So somehow, stammering, stammering, uh, so yeah. My question is to you, like, how can I recognize that that problem is coming from the from my neurological part or from my psychological part? Yeah.
I'm sorry, could you just specify sort of what you mean when you're
Uh,
saying biological part?
see, the study spoke people who stammer, uh, the wiring inside the brain is different from the people who actually not stammer. So this is what we call as a being a stammer person. And apart from that, let's say I'm a teacher and I got stuck, and in that case, the feeling that I have most inside my body, inside my mind, what we call it. So my question is to how can I recognize, how can I identify the situation that I'm facing right now. This is what purely from my neurological part or from my psychological part. Like if I am dividing the stammering into the two component, the 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 psychological, uh, that is influenced by the societies, and on other side, of course, because my brain wiring is totally different. So how can I recognize, so what are this such situations at all? Yeah.
Okay, so you mentioned neurological cause of stammering. Now, research is still in its early stages. We have not concluded that 100% there is a neurological cause. There are many schools of thought. Neurology is just one of it. Uh, there are there are philosophies that believe it is the environment, it is the growing environment, or the language expectations from the child. Many beliefs like that. So rather than pinpointing on the cause of it, I think just becoming aware that you're having these thoughts about stammering, becoming more aware about it, and then knowing that these are just thoughts that you're having. If you get a thought in your head and just you let it go, and then you try to speak, that could be something that would help. Now, this I am talking from a more rational emotive behavior therapeutic way. So, I think to go into the depths of it is a bit beyond the scope of our podcast today.
Khajendra Sharma, would you like to ask your question?
Yeah, sure. Yeah, first, hi, Harshada.
Hi, Gajendra.
Yeah. So I have one question. Like we all stammerers, we always have bad memories. Means like in past that has really affected us, and it is very difficult to erase it. So as a stammerer, like how to work towards it? Like your thoughts?
Um, it would be a very long process, and it would require a lot of active awareness and mindfulness from your end. So it's not like a one day project. Just becoming aware of your thoughts, knowing that these are stemming from a past incident, and that does not define or you know um, predict the future. Becoming aware of it and even accepting it is quite a long journey. So all of this you could try on your own, but the best way to do it is with a therapist. Therapists would be the best people to guide you along the way, and because it is a very hierarchical process, it's got different stages that you go through, and yeah, a professional would be the best to help in that case. Have you had any experience before?
Yeah,
Ending?
yeah.
Yeah.
Yeah. Actually, I've taken speech therapy in Bangalore, but it is like mostly not like psychological. It's mostly like they give some numbers, we have to speak, and they tell we have to take a breath and then speak. So it's like mostly speech part.
Right, right. Got it. So then I think the best thing for you to do is to find a speech therapist who would work on this as well. Because there are all these dynamics. It's not necessary that a speech therapist and you have that bond or their perspective is the same. So maybe, before you start taking therapy, having just an introductory session with the therapist could be helpful. So that you also get an idea about what the therapist would be working on in the future, and you can take an informed decision then.
Okay, thank you.
Uh, Thank you, Gajendra. Irfan, would you like to ask your question or share your comment?
Yeah, ma'am, first of all, I would like to extend my sincere thanks to you on this beautiful p- p- platform. And my question is that does uh, speech therapy plays a significant role in the people who stammer? Because there are many myths, there are several beliefs about stammering. Because I myself came across several people who said that it was not beneficial for me, it was not fruitful for me. Yeah, now I would like to get to know that being a language pathologist, what would you like to say about it? Thanks.
That is a really good question. Thank you for your question, Infan. So, like I mentioned briefly earlier, traditional speech therapy has focused on reducing stammering only. That has been the only goal, to be 100% fluent. But now the understanding is that nobody is 100% fluent. Even I stammer sometimes. It's just not so often that it becomes noticeable. So, forming this belief and basing therapy on this is what I believe would be beneficial. Like I've been mentioning, just not just speech therapy techniques, because techniques would work someday, sometimes they wouldn't. So, in that case, knowing what you have to do, getting the tools basically, it would be helpful for you. And so, again, like I mentioned in response to Gajendra's question, knowing what your therapist's philosophy is, what they believe, what their plan of action is, would be one thing. Second thing I would encourage is you also take active participation in setting the goals for therapy. so that it becomes bidirectional. It's not just the therapist telling you what to do. You know what you want, and you can ask the therapist to modify or plan the session in that way. And yeah, so that is one of the reasons that I had attended the Vanvadi workshop as well as this podcast, is to create more positive awareness regarding speech therapy. I know many people are skeptical because of previous past experiences, but I must say the field has come a long way. There's a lot happening, a lot of research happening regarding stuttering, and um, yes, I believe now we are at a stage where it's not focusing on the listener experiences, that when a stammerer is speaking, the listener has to listen to the stuttering or stammering. It's more of what the stammerer is experiencing. It's more of stuttering well or acceptance of stuttering. So I think all of this would be worked on in speech therapy, and yeah, I would definitely say that take an informed decision regarding who you're taking as your speech therapist, because that plays a very big role in your journey as well.
Thank you so much for asking that question, and thanks for Archada for answering it really well. So I have one question in the comment which says, I mean, are there any mouth exercises out there to reduce stammer? It was asked by Nyai.
So there are exercises, you will find them on Insta Reels, you'll find them on YouTube, but all of these are not reliable sources. And there are no mouth exercises as such that would reduce stammering. And I would best recommend speaking with a professional before even trying those techniques out, definitely.
Yeah, thank you. Thank you, Ashada. Uh, Dr. Vijay Avare, would you like to ask your question?
Am I
Yes,
audible?
yes, Vijay, yes.
I'm sorry. Hello. Sorry, I joined somewhat late. But I have question. But if we have to take speech therapy, then which one is better? That we should go to speech language pathologist, or we have to take it from speech fluency shaping kind of thing. Uh, which one is better for us?
I'm sorry, sir. Could you repeat which is the
Okay,
second one you
uh,
said? A speech language
I will
pathologist
repeat.
or?
I am repeating it again. Uh, Actually, somewhere, so I read the two terms. One is a speech language pathologist. Speech fluency is taken from speech language pathologist, and uh, uh, speech fluency shapers. I mean, the person who is shaping the speech fluency. So, uh, so what is the difference in that, and which one is better for us?
Um, I must confess, this is the first time I'm hearing this speech fluency
Okay,
shapers.
okay,
But I can definitely tell you that speech language pathologists will help with speech
sure.
therapy.
Okay. And one more question I want to ask you, that so I belongs from engineering background. So I did my PhD in farm machinery and power engineering. Suppose I want to do this one SLP, speech language pathology. So what is the qualification for that, and can I do this in this stage?
So as far as I know, for a bachelor's in audiology and speech language pathology, there is a age limit. I think above 28 years of age, you wouldn't be eligible. But I am also
Okay.
aware that there are a few diploma courses. Diploma
Okay.
in speech and hearing. I think it's diploma in hearing, speech and language, like that. So there are a few places in India that offer this course, which would be a 1 year program. But in that, you wouldn't just study about stammering. There are all these other speech and language disorders that you would study as well.
Okay, madam. Okay. Thank you very much for your answer. Right.
Thank you, Vijay. Next
Thank
we
you, Vidyaji, for the nice podcast. Good.
thank you. Thank you, Dr. Vijay. Thank you. Next is Vaijoba. Would you like to ask?
Yes, ma'am. My question is that, hello, I'm
Yes,
audible?
yes, yes.
Yes,
Yeah,
yes.
my question is that how to overcome our fear because we do that we're stammer and in the class, in the class colleges we know the answer, but because of time stammering we can't answer that because they will laugh like that question it will come in our minds. So, like how to overcome that fear.
Um, like I mentioned before, it is not a 1 day job. It would take a very long journey of self-reflection and mindfulness. And so, first comes acceptance of stammering. And once you reach there, then I think automatically all of these fears and other negative thoughts would reduce on their own. And again, if you're seeking help, I would definitely recommend speech therapy.
Thank you, Vaijob, for asking this question, and thanks,
Okay, thank
Arshada.
you for your answer. Thank you so much.
Uh, s- so, do we have any other questions here? Uh, Participants, would you like to ask any other questions? And actually, Saurav Gupta, I mean, asked another, like when we were talking about, I think, some mouth exercises, he also, I mean, asked about tongue twist. Will that help?
So no, there is no evidence. It's not research backed that practicing tongue twisters helps with stuttering. I know that is a prevalent belief, but there's no research as such that states that.
Yeah, ma'am, Saurabh this side. Ma'am, what's about the pattern of breath? Do you think that it is quite helpful in order to overcome the stammering? Do you think that?
Definitely. Definitely. So, modifying the breathing pattern is also something that I would focus on depending on the person if they require it, because that the breath is the source of our speech. First, we breathe in, and then while we're breathing out, we start speaking. So, definitely, breathing also has a very major role on speech and stammering as well.
Yeah, like you said, of course. The thing, ma'am, how about that help us focus like as earlier I was mentioning, and apart from that like apti like apties like when you solve a mathematics problem, then do you think that before sleeping just solve a fever problem that is from aptitude or maybe from it might be from reasoning or uh, or some games. Do you think that that helps quite in order to reduce the stammering?
Not
Like
entirely
let's say
sure.
let's yeah yeah ma'am please.
Yeah, I'm not entirely sure about the context in which you're speaking about all of these activities, but there is no evidence that suggests that solving any basically brain stimulating activities before going to sleep has any association with reducing stammering.
Maybe he was
So, ma'am, what are the
sorry.
ultimate?
Yes, please
Yeah, ma'am.
continue,
With
Saurav.
them. Ma'am, yeah, in the context of like, let's say there is a problem of DSA solving the data structures and algorithm, or there might be problem of percentage, or there is a problem of number series. So, like in that context, I was asking.
Maybe
Uh,
he's talking about some mindful activities that we put our brain and put our 100% inside. Uh, were
hmm.
you referring something like that, Saurav?
Yeah, actually, somehow it is, ma'am. Somehow it is, of course. Yeah.
So, earlier sort of mentioned maths problems, mathematics. I'm not sure how that would be helpful, but definitely engaging in mindfulness activities anytime during the day, really, will definitely be helpful.
Okay. Okay, ma'am. Okay, okay,
Thank
okay.
you, Saurav.
Yeah, it means, ma'am, there is only one thing by which we can overcome. That is, first of all, acceptance yourself that you are a stammerer, and apart from that, like do some desensitized activities in the public place. That is a kind of impromptu speech, or doing some techniques. Maybe they might help helpful here. So these are two activities that I would say, like, that I am concluded from this podcast. So, am I correct, ma'am? Yeah, yeah. Is
Yes,
there
yes.
anything else? Yeah. Okay.
No, that's great. I'm so glad you have this takeaway.
Okay. Thank you.
Thank you, Saurav. Thank you. Uh, so we will take the last question now. Vaijoba, would you like to ask your question?
Yes, ma'am. So my question is that is there any medical treatment to reduce our stammering, or only we should practice more, we should talk more daily, or we should read the books loud way so then we can reduce our stammering? Or is there any medical treatment, let's say, can you please guide me?
Yeah, sure. So there are no medications. I know this is quite prevalent in India, I think. I know specifically in Pune as well, we have a few medical practitioners claiming that they can cure stammering, but there is no cure as such. See, speech is a behavior. So, speech therapy is what will help you. Using speech techniques, practicing them is what is going to help you. And within speech therapy, then we have different levels, like what you mentioned, reading. So, that would be one of the earlier levels where before you start practicing in speech or in conversation with someone, you're actually practicing the technique while reading. And then it goes through more higher and higher levels of difficulty. But definitely, there is no medicine that would cure stammering. If there was, I think it would have been world famous.
So when at the time of purchasing like groceries in a shop, so that time we'll stuck in between, like like to asking that time we'll stuck in between. So that time, like how to deal them,
How to
I mean, deal with it.
how
Like,
to
deal with it?
deal with.
Okay. Um, so there are many ways that you could actually do that. One would be to try to use your speech therapy technique if you're using that. Another could be to simply self disclose and tell the person that I am someone who stammers and it will take me some time to speak. So please be patient, or whatever self disclosure script you have prepared for yourself.
Yeah, that will.
Okay. Yeah. Okay. Thank you, ma'am. So I recently joined this. This is my first meeting here. So I joined it here. Yesterday only I joined in group. So is there any classes? I heard from my friend. He told there is one three classes and MOCC. Is there classes? MOCC, like the classes there for reduce stammer.
We will be having the next TOPG and MOOC session in TISA. You will be informed about that, Vijay.
Okay. So he
Yes.
told that his classes is there in Telegram. In group you chat with them. They will link. They will share to you. So MOCC like that. He told. I'm not sure about that. So I said okay. I will do inquiry like that. I told to my friend. I don't. So I just asked here. Tomorrow also his session is there.
Which session are you talking about now?
This
I mean,
session
this
is
is
going
a
on
podcast which will air, which will happen weekly. But then
weekly once. Weekly
about
once.
weekly once. But then if you want to know about the techniques and how to handle
Yes,
stammering
yes, yes.
mindset and
That's
stuff,
yeah.
I mean, I think you will be informed about that through TISA, Telegram, and other groups itself.
Yes,
You
yes. He
just have
told
to
that
wait.
when
Yeah.
inform. Yes.
Yes, yes. I mean, I mean, inquire and let you know as soon as possible.
Okay, okay. No problem. Thank you.
Yeah. Thank you. Thank you, Vaijab. So, yeah. So we will now come to the end of the podcast. And Arshada, thank you so much for sharing your insights and patiently answering all the questions. And you brought a depth of knowledge to this conversation. Thank you so much, and wishing you all the best in your work and future research as well. And thanks to our audience for joining us. And we truly appreciate your time and engagement in this podcast episode. Thank you so much, everybody. Yeah.
Thank you, Vidya.
With
I would really want to share my heartfelt gratitude for this invitation, and it has been a pleasure to just be here and answer all of your questions.
Thank you
Thank you.
so much. Yeah. Thanks to Dr. Sachin as well, who's encouraged me to do this. So, yeah. Thanks, Arshada. Thanks once again. Thanks,
Thank you.
everybody.